When you hear adolescent drug use, who do you picture? Very likely, you will have a certain idea in mind that may be the result of any number of influences, such as media portrayals, drug education programs, and personal experiences, among others. Please take a moment right now to set aside this picture.
The reality is, anyone may be using drugs, regardless of where they live, their socioeconomic status, whether they're an introvert or an extrovert, an athlete, a musician, or a straight-A student. And using drugs does not make them bad kids. By acknowledging this, you can reduce the risks of causing unintended harm that can happen when you stigmatize somebody or act on implicit biases.
Are some youth at higher risk? Yes. There are some factors that increase someone's risk for developing dependence and substance use disorders. These include mental health conditions like depression and anxiety, as well as adverse childhood experiences, also known as ACEs. These include emotional neglect, sexual abuse, physical abuse, racism, discrimination, housing instability, and others. It's important to look out for these risk factors so that you can respond compassionately and identify appropriate resources and support for the young person.
Why might someone use drugs? Every person is different and may be using various substances for different reasons. Some possible reasons why a young person might use drugs include exploration, recreation, self-medication for mental health conditions like depression, social connection to peers who are using, so trying to fit in, look cool, or just feel more relaxed and social. Exposure or access to drugs. Exploitive marketing tactics, especially targeting adolescents, Black and brown youth, and LGBTQ+ individuals. And lack of comprehensive drug education and overall health literacy, especially in underserved populations.
By developing a trusting relationship and two-way communication, you can learn why some adolescents use and respond with more practical and compassionate guidance. For example, if they are using drugs to cope with stress, you might help them understand the source of stress and how it affects them. Then teach them healthier ways to cope with the stress instead of self-medicating. How do you define substance use? Don't think of substance or drug use as a binary state, using or not using. Instead, think about it as a continuum of use. Not all youth use drugs. In fact, many youth will have never tried, and some will never try drugs. Some try or use drugs occasionally or regularly, while some use to the point where they are dependent on the drugs and have a substance use disorder. People may not move linearly along the continuum. They may jump from one part to another. They may also be at different points on the continuum for different substances. Framing your conversations within the continuum provides several benefits. First, by learning where a young person is on the continuum of use for specific substances, you can provide more targeted resources and have more nuanced discussions about drug use and harm reduction. You can also address a young person's own misconception that most of their peers are using drugs. Finally, the continuum of use is also important in group settings. In any given room, there will be individuals at various points along the continuum. Describing drug use in this way helps to engage every person without alienating anyone, including those who might have used.